Today's vlog segment is going to be a companion piece to a couple other videos we already filmed. One of which was looking at the upper and lower eyelid as a balloon and a shoreline, and then the one that I shot yesterday, which was rethinking the eyelid crease position when looking at the upper eyelid and the importance of preserving identity and really providing youthful rejuvenation that doesn't change someone's look. Today we're going to talk about more in depth the lower eyelid, and really what I wanted to focus not so much on the shoreline idea, which is talked in depth in the other video, but approaches surgically that can achieve consistency in results and avoid pitfalls and problems when dealing with the lower eyelid. I'm going to make it very simple in one sentence. I don't cut on the lower eyelid, period. I have seen way too many complications in the lower eyelid using what's traditionally called a skin muscle flap, which is the incision under the lower eyelid. It's not the problem of scarring, which is pretty uncommon to have a scar under the lower eyelid if the surgery is performed well. That's not the reason to avoid an incision. The reason to avoid an incision, and I see this so often, is some kind of malposition of the lower eyelid. In other words, the lower eyelid is either pulled up a little bit too much after the procedure, or even worse, pulled down a little bit too far in the procedure. And sometimes there's blunting of this area called the lateral canthus, where it moves in and is rounded. And I can almost tell that stigma from many people that I look at when I look down at that area, and it can be the most devastating complication out there, because it's not just an aesthetic look that can look very, very bad, but in addition to that, it can be a functional problem. If you think about how the eyelid drains, it's about 80% of the lower eyelid. That lacrimal system drains principally from the lower eyelid, so there's a functional component to that muscle where when the eyelid closes, there's a squeezing of the lacrimal system and drainage. So besides eyelid exposure of having this down too much, you can, by cutting on it, you can also have improper drainage where it actually doesn't drain well. You get dry eye symptoms, and that is a real problem. But if you ever see this sort of droopy dog look on the lower eyelid where it's pulled down, or if it's a little bit, if you will, Asianized by pulling up, I think it looks really bad. So my safety is not to cut on the lower eyelid. I don't take skin out, I don't tuck muscles back, I don't pull things back, I simply don't make an incision. And I think that's so fundamentally important. The evolution of my strategy when I was doing the incisionless techniques to take out fat bags was good, but far from great. It was a safe procedure without complications that you would see with the skin muscle, but it wasn't achieving what I wanted to achieve in the lower eyelid. So safety is important. It's probably the most important, or it is the most important thing that we look at when we're looking at the lower eyelid. But the second most important is getting a great result. So how do I approach the lower eyelid differently if I don't pull back? Because it's so easy to do what I call the two-finger rule, is just to take your finger and go, Doc, this is what I want. I just want to pull this back and it looks so much better. Well, that's the principle of the skin muscle flap, but I'm very, very opposed to it, not because you can't get a good result, but the complication rate is extremely high, even in experienced hands. And you say, well, come on, Doc, I went to a surgeon who's very, very good. He showed me a lot of good before and afters, very low complication rate. And yes, in experienced hands, a skin muscle external approach can have minimal complication rates. But I will also tell you this much. If you really look carefully at even experienced results with the lower eyelid, you will see a little bit of rounding, a little bit of change of the eyelid shape, which in my opinion is unacceptable. And then you look at the real problems, where I've talked to a lot of patients who've actually gone through about 15 to 17 revision surgeries on the lower eyelid, and that's a real problem. And we're not, again, just talking about an aesthetic problem. We're talking about a functional issue. So no cutting at all, in my opinion, is allowed in the lower eyelid. So what are we looking at when we're talking about how to correct the lower eyelid? I want you to envision the lower eyelid as three problems. There is either there's a fat bag that can be there. There can be an absence of fat in the lower eyelid, which is the hollowing that goes on. And finally, there can be wrinkles or skin damage and aging from that perspective. So when we look at the three components, we have to look at which is the most important. Interestingly enough, the most important is actually hollowing of the lower eyelid, where you put fat back in, and that's the principal mechanism by which I rejuvenate the eyelid. And initially it sounds counterintuitive because it looks like there's too much fat. But in the majority of cases, just putting a little fat back under the eye can achieve wondrous results in terms of rejuvenation. When we're looking at the upper portion where there's a fat bag, as we talked about in the shoreline video, oftentimes we can camouflage that simply by putting the fat under. You don't need the bag out. But about 1 out of 10 patients, I do take the bag out. And probably about 1 out of 5 patients, I'll tighten the skin a little bit by rejuvenating either with plasma or other types of laser treatments. So I divide that into 3 strategies, all of which do not require a cut. It's one of the places I'm the most adamant about not making an incision. The upper eyelid, it's safe. If you do it carefully and you're a good surgeon, you're going to have a good result in the upper eyelid if you balance it, in my opinion, with fat grafting. But the lower eyelid is one of those areas that I just want to speak more specifically about safety issues so that you understand how adamantly I'm opposed to making an incision in the lower eyelid in almost every circumstance.